Hello and welcome back to the Tropical NurseTalk, the podcast where we explore tropical nursing through the lens of culture and local wisdom. I'm Grace and I'll be your host today. We are joined by a very special guest, a doctor but she also graduated from a tropical disease field, Dr. Faizatur Rosyidah, M.Ked.Trop. Welcome, doctor. It's great to have you with us.
Thank you for having me. It's a pleasure and I'm really glad to be here.
Doctor, this is fascinating. I often hear patients say things like perutnya panas or I got hit by kena angin duduk. These expressions can be quite confusing, especially for young healthcare workers, right?
Absolutely. When a patient says perut panas, it could mean a number of things. Anything from diarrhea, acid reflux to even a gastrointestinal infection. And masuk angin also has broad meaning. It might refer to flu-like symptoms, fatigue, muscle ache, or even early signs of tuberculosis in some cases. That's why it's so important for healthcare workers, especially young healthcare workers, to understand the local language and cultural expression, so we can ask the right follow-up question and interpret those symptoms in clinical terms.
Okay, and angin duduk doesn't literally mean sitting in the wind, right? And it can you actually refer to something serious like a heart attack.
Exactly. That's why it's crucial for nurses and healthcare workers not to laugh or dismiss these local terms. Instead, we should explore their meaning with empathy. For example, we can ask, what does masuk angin feel like for you, ma'am? By doing this, we are not only respecting the patient's cultural context, but also gathering the right information to make a proper clinical judgment. It's about meeting the patient where they are culturally and medically.
And angin duduk doesn't mean sitting in the wind. It can actually be angina pectoris, a heart attack.
Yes, exactly. It's important for nursing staff not to laugh at these terms, but rather explore their meaning. What does masuk angin feel like for you, ma'am? That way we can understand the cultural context while still applying proper clinical judgment.
So, this is where nurses play a big role, right, Doc? Bridging the gap between the patient's culture and medical science.
Exactly. Nurses are on the front lines. They interact with patients the most. That's why it's crucial to have cultural sensitivity, being aware of the patient's values, beliefs, and habits.
So, kind of like a cultural translator?
Yes, or you could say a cultural bridge. Nurses don't have to agree with every cultural practice, but they must be able to respect it and communicate safe, evidence-based solutions effectively.
So, can you give me an example?
If a patient says they want to do kerokan, for example, first we can respond, go ahead. You can do that as long as it doesn't cause injury, but please continue taking the doctor's prescription or medication.
Doctor, from our conversation, there are several key vocabulary terms we can highlight: herbal remedy, traditional medicines, cultural sensitivity, awareness of cultural values, health communication, communicating about health effectively, traditional belief, local or cultural belief, culture bridge, a bridge between culture and science.
And most important, we respect culture without compromising our patient safety. This is the art of tropical healthcare.
Wonderful. Thank you so much, Dr. Faiz, for your insight today.
You're welcome. I have fellow healthcare worker, especially for young fellow healthcare workers, become more aware that cultures is not a barrier, but it is a potential we can embrace.
Okay, see you in the next episode. Stay healthy and respect local culture.